Hi there. My name is Dr. Jeffrey Brown, and I am honored to tell you about my partner, Dr. Brendan Stack. This gentleman is world famous in the field of temporomandibular joint disorders, and I'd like him to tell you about when he started the practice and what we do here.
I first started this practice in June of 1965. It started as an orthodontic practice because I'm a graduate of a university-trained orthodontic program. But I soon began to notice that most malocclusions and children with buck teeth and crooked teeth had an underlying temporomandibular joint problem which had never been addressed and was causing such symptoms as face pain, headaches, migraine-type pain, neck pain, clicking joints, limited opening, etc. So I started to address that underlying TM joint problem first and then doing the orthodontics afterwards. Subsequently, we started to notice that a lot of these children had movement disorders, such as facial tics and head jerks and so on and so forth. And so we started to address that too, and we found that they also had an underlying temporomandibular joint problem, which once we addressed and fixed, cured them from these abnormal movement disorders. And we started to apply this to other groups of patients, such as Parkinson's patients with abnormal movements. Now we're not treating Parkinson's patients or Tourette's patients. We are treating the underlying temporomandibular joint problem, which appears to be existing in these both groups of patients.
As it turns out, about 80% of the children out there under the age of 18 have some sort of a dislocation in their jaw joints. This is something we are starting to pay attention to on a daily basis. If anyone is endeavoring to have orthodontics done, they really should have a proper screening of their temporomandibular jaw joint to see if there's an underlying problem before you do orthodontics. And we see this on an everyday basis now. Patients come to us, they're either in braces or in Invisalign, or they just had braces and they're hurting. We see this every day of the week, and we have to start from scratch. Needless to say, it becomes expensive, time-consuming, and outright painful at times meeting these people when they've had a problem with previous treatment. Once we address the underlying problems, then we are able to redo the orthodontics for them to the proper configuration, and it works.
This is the joint we're talking about, and we document what we do and our findings with magnetic resonance imaging. In other words, we take MRIs because we have an MRI center located very close to us. So it's not just our opinion, we have it documented in black and white. The MRIs are read by a radiologist who's world famous and known throughout the world for his accuracy, and we base our treatment on his findings.
I tell patients every day, when you go to the MRI center, which is literally next door to our office, you're actually getting a strong second opinion. We're basing this not just upon our findings, is what I tell the patients, but you're getting a radiologist from the National Institutes of Health to give you a second opinion on your situation. I'd like to talk about sleep apnea. Basically, one of the fundamental things with children is children should absolutely not snore. Snoring is extremely dangerous to their health. It causes vibration to the carotid artery, which can cause atherosclerosis, leading to stroke, coronary heart disease, and this is just with children. In adults, it's much worse and much more dangerous. These are one of the things that we screen for in every patient that walks through our door.
Sleep apnea means the absence of sleep. The patient stops breathing. Usually the sleep partner is the first to notice this. The patient wakes up gasping for air after a pause of longer than 10 seconds with no air. Sometimes the pause can be up to 2 minutes where the patient is not breathing. Essentially, he's dead or dying. And you should be aware of this. And this frequently also has an underlying TM joint component to it, which allows his jaw to drop back when the patient sleeps on their back and closes the throat, because the throat is suspended from the lower jaw. It's a membranous tube suspended from the lower jaw, which collapses when the jaw drops back. So that's why the patient stops breathing. He can't breathe. It's physically impossible for him to breathe.
At our office, we tell our patients, go out and save a life today. If one of your friends or family snores, gasps, snorts, anything like that, and if you can identify a sleep problem for them and help them out, you're saving their life. Snoring, apnea, they all take 10 to 15 years off of your life. So go out and save someone's life today.
How would you like to have 10 or 15 years of more useful life? Think of all the money you could make.
And that's my partner, Dr. Stack. Thank you very much. When a person comes to our office for an orthodontic appointment, we do a pre-screening here at our office. We look at various things like the muscle attachments under the tongue, above your teeth, how high the roof of your mouth goes, the width of your mouth, the level of your ears, your eyes. All of these things actually play into our orthodontic treatment program because we bring in the disciplines of sleep, the discipline of TMJ therapy, and we bring the whole thing together into a proper orthodontic plan. Part of the reason is, unfortunately, we see way too many retreat cases in this office because the whole patient was never looked at from the beginning.
Our orthodontic techniques that we have developed allow us to treat these patients without having to pull teeth unnecessarily. We very rarely pull teeth on a patient to make room, nor do we have them wearing a headgear, which is one of those devices that goes around the outside of their head to push their teeth back. In fact, we feel that patients hate to wear these things, particularly to school or at work, and patients and parents particularly hate to have teeth extracted on their children.
I was very lucky to come on board with Dr. Stack a year or so ago. When I started learning his techniques, I realized this is the key to doing proper orthodontics. At our office, we actually can do Invisalign for you, Clear Correct, the various clear aligners, no problem whatsoever. Recently, we just started with the Insignia program, which is a computer CAD/CAM scanner system. The computer will actually manufacture individual brackets, wires, braces for every person's individual needs. And Dr. Stack and I will design and position their teeth on a computer CAD/CAM system to get the best placement possible. It's fantastic technology.
It's the wave of the future, and we're part of it.
In our office, we offer to all the children that would like to come to our office an absolutely no charge initial consultation for orthodontic treatment. We pretty much do this every day of the week. We get kids in here. We give the parents guidance. We give them information on their palatal development, their tongue development. We discuss breathing. We discuss sleep. We discuss headaches and neck aches because we help with all those items. And if they're popping, clicking, and other things going on in the joints, we identify that early before it becomes too late.
We also recommend classroom visits to our office. If you're a teacher listening to this, bring your whole classroom over here for a tour of our office.
Hi, my name is Dr. Jeff Brown. I originally met Dr. Stack about 10 years ago or so, and initially at that time I thought it'd be a great idea if maybe we could work together, develop our practices together, because my focus back then was on full mouth reconstruction, and I was heavily into TMJ and jaw development and very similar things, and at that time it just didn't work out. So just last year we met again and talked again, and this time it actually worked out very well. I've been transitioning with him. He's been my mentor for the past year. I've learned so much from this man. I really appreciate everything that I've learned. And with all good luck, he and I will be working together for several more years to come. Mm-hmm.
It is with great pleasure I've welcomed Dr. Brown into my practice. I've been looking for someone to turn over all my knowledge and wisdom to take care of all my patients, because I just don't want to leave everybody in the lurch. I've interviewed many people, literally dozens and dozens, and turned down very lucrative offers to be able to have Dr. Brown in my practice to convey all my knowledge and wisdom to.
And I must say that I learned something a long time ago back in business school, that when something works, you don't change it. Dr. Stack created a system that works that to date I've not seen anybody in this entire world be able to duplicate. The way things are done here in this office with orthodontics, sleep, TMJ treatment. We brought the whole thing together in one precise package that I meet people from around the world every week or so, and they simply cannot duplicate what this office can do.